in this by-election to win it. As you've seen, the polling is really tight. And let's not forget that Selby on the old boundaries was held by Labour from 1997 until 2010. And under that Labour MP, they had a new hospital, a new bypass, they had new flood defences and a direct link to London. That is what a Labour candidate and a Labour MP can achieve for Selby and Ainsty. And you know what? People have had enough. They've had enough of this chaos in the government nationally, played out through a civil war that's like some sort of soap opera at the time that we have a cost of living crisis. People in Selby and Ainsty are facing £336,000 a year extra on their mortgages. It's time for change. It's time for a fresh start under Labour in that constituency. Our seat at the moment has seen a country that has had 230,000 people die from COVID. Worst cost of living crisis for 40 years. NHS on its knees. This is a country that is broken after 13 years of a Tory government, and constituencies like mine, where I grew up, are ready for change. They are desperate for a Labour Party to build a better Britain, and that's where we are now. And that committee was a committee that was chosen and approved of across the House, including the chair. Every single member of MP, a member of Parliament appointed the MPs and the chair of that committee, including Boris Johnson. And to undermine it at this stage is just not appropriate.
Disposable vapes are going to be banned from Glastonbury this year. Should they be banned overall?
What we've said is that it's not right that companies are profiteering off the back of children consuming nicotine and potentially harmful chemicals. We know that teachers across the country are finding that children are getting distracted and that are sneaking out of lessons to go and vape. And what Labour have said that we would do is ban these brightly coloured packaged vapes and make sure that we also tackle the issue around advertising. But the Conservative government voted against that when they had the opportunity to ban them, which is it's not fair. And, you know, all of this is off the back of 13 years of pulling public health apart. You know, we've seen 26% less funding per head since 2015 for the population on public health. And in particular, stopping smoking is one of the areas that's been most affected by that. And that clearly is trickling down and impacting children and young people in our communities.
Down the road, like we've seen in perhaps some other countries, Australia, for example, they've banned recreational vaping. Would you like to see that happen here?
I would like to see this issue being tackled head-on now. We had the opportunity to do that in Parliament. But we've got to remember that this is in the context of a public health service which has been decimated through the course of the last 13 years. You know, 3 million is nothing, a drop in the ocean, compared to the 15 billion that was taken out of local authorities' funding and the impact that's been had from those cuts on public health grants that local authorities had. And so we can't do the sorts of things that we would like to do, including making sure that children stop vaping, because the government have taken those public health schemes apart. They got rid of Public Health England during the pandemic and they haven't replaced it. You know, Labour's laser focus on health will be on prevention, on doing things like making sure we have emission assessment board to look at how we can improve public health problems like this. We would make sure that we would be putting funding into primary school free breakfast clubs so that children are getting wraparound support from an early age. And this is all part of a big picture of health inequalities that are being affected because we've not had that public health service running coherently that used to be world leading.
Murray, do you think there needs to be a dedicated national men's health strategy?
I mean, that sounds important, but it should be really as part of a bigger strategy within the NHS and what Labour have said that we would do to make sure that we tackle this crisis in cancer care, where we see 35,000 people a month, 420,000 people a year waiting more than 2 weeks to see a specialist after having a referral from a GP, is Labour have said we would put in place 7,500 new doctors, 10,000 new nurses, paid for by banning the non-dom tax status, to make sure that right across the NHS and right across cancer care, we're much more able to pick up and prevent and find those signs and treat things early. And doing that means that you're much more likely for 75% of cases across all cancers to be caught at stages 1 and 2. And we know for all cancers, including prostate cancer, that improves the longer-term prognosis for those individuals.